So with that, I would like to move into the first session, but first introduce Dr. Jeanette Vega, who's in fact, who opened the opening remarks for the session that follows on social infrastructure. Jeanette is a member of the International Commission. She's the former Minister of Social Development and Family in Chile, and she is internationally active. Jeanette and I serve on several committees, including the GPMB previously. And so welcome, Jeanette. Please come to the stage.
First of all, good morning to all of you, and many thanks for the invitation to be here today. And in fact, I am a proud member of President Boric's cabinet. I was Minister of Social Development and Health, and now I am transitioning probably to a position to be more close to his office. And I'm very glad to be here. So we are going to talk about Chapter 4. Chapter 4 of the report is about social infrastructure for healthy longevity, and it lays out key targets for achieving the social infrastructure goals for the Vision 2050 to achieve healthy longevity. It also lays out recommendations and explain what should be the supporting structures to assist in that process. As the previous speakers said, many aspects of health longevity are influenced by the social determinants that are the conditions or circumstances in which people are born, grow, live, work, and age. All of those are shaped by the social, economic, and political forces. And of course, social determinants of health cannot be addressed or resolved only within the health system. The chapter discusses current evidence on key social determinants of health in aging, ageism and age discrimination, social exclusion, lack of financial security, the digital divide that affect the achievement of healthy longevity, and their interactions across individual and institutional levels. It also highlights programs and policies that promote equitable outcomes in healthy longevity. Integral to the discussion in this chapter is the cross-cutting theme that the intersection of family, community, and social cohesion has a vital role in achieving healthier and longer life. Interventions geared toward building social cohesion and social capital within communities can contribute to the cultural change needed for older adults to be more engaged in their societies. But the interventions to promote social cohesion and social capital need to be paired with policies that combat ageism, promote social inclusion, protect the financial security of older adults, and improve opportunities for developing competence in using technology. One of the critical systems is to have a comprehensive financial security system. This is critical to mitigating socioeconomic inequalities and providing opportunities for all individuals and families to navigate their health, education, and work circumstances, and then contribute to society. We know that all people at all ages require a reliable, adequate income, but this need increases with age. and the lack of it decreases the chances of older adults to remain healthy. Financial security benefits everyone because people with a secure income can contribute to their communities, have decent quality of life, and most importantly, live with dignity. Finally, the chapter argues that all social infrastructure areas would benefit from greater understanding and insight. So it is important to ensure that translational research is funded and conducted across an array of areas, and that knowledge inform governments and other stakeholders. Findings emerging from this research will be a valuable addition, not only to knowledge generation, but also to the generation of evidence-based practices, policies, and programs to ensure achieving the Vision 2050. I just wanted to conclude by saying that in addition, we need to really move from traditional health systems to care systems, systems that support, coach, and train caregivers and people. We need to acknowledge that the configuration of health system, in fact, begin at home, that there are different roles of institutions, healthcare workers, family caregivers, and others, and that we have to learn how to utilize digital technologies to provide care in social sectors that allow to be more efficient in taking care of older adults. So with that, I conclude my remarks, and I would like to welcome the three panelists for the first session. So I'd like to welcome Erwin and Edwin and Aggie to the session. Thank you. And we have a wonderful group of panelists here. We have Erwin Tan, who is the director of the American Association of Retired Persons through Leadership Health, and thank you for being with us. Also, we have Edwin Walker, who is the Deputy Assistant Secretary, Administration on Aging and Administration for Community Living. Thank you for being with us. And then I have Abby, who is Managing Partner at Primetime Partners. Many thanks for being with us. And this session basically will convene panelists that will offer remarks on the prosocial strength of older people, ageisms and age discrimination, social inclusion, financial security in retirement, and digital literacy. So I really want to thank again, and let me ask Erwin to begin.
So thank you all for having me here today. I first talked to Dr. Zhao about the Global Roadmap for Healthy Longevity in 2017. And it was shortly after our CEO, Joanne Jenkins, CEO of AARP, wrote this book called Disrupt Aging, which really encapsulates the issue of how perceptions of aging and age stereotype threat can influence your health. And Joanne Jenkins also is one of the co-vice chairs of the International Oversight Board that oversaw the commission that wrote this report. And I think her book can be best encapsulated by the phrase, 50 is the new 50. which is to say that the first 50 is your age. And whatever age you are, whether it's 5, 18, or 52, my own age, you are the perfect age to do what you need to do right now. It's that second age, the second number. So that is what society feels you should do. And that, I think, is the challenge that we need to change. And I think there's a lot of evidence to suggest that your own perceptions of aging or how we react to these age stereotype threat can influence your future health. And I think I'm really excited to talk about those issues. Thank you.
Thank you very much. So I'd like to now ask Edwin to basically talk about, in particular, some efforts related to healthy aging.
Well, thank you so very much. Again, I would also say it is my pleasure to be here. And I want to thank Victor for sure, and Linda and John for leading the commission that developed the global roadmap. Linda asked me this morning, she says, is it going to be helpful? I said, absolutely. I'm with the government, federal government here in Washington, D.C., and it is so consistent with the many things that we are attempting to do, the things we believe in, and from my perspective, it's going to give us credibility and enable us to move forward in terms of identifying issues and highlighting issues that contribute to healthy longevity. We have previously spoken of healthy aging, but we as a group thought that healthy longevity was a broader term encompassing the entire lifespan, and so it is right on in that regard. In terms of today's panel and this discussion, I was asked to speak a little bit about social infrastructure and highlighting what we have here in the United States. We have a very well-recognized social infrastructure related to older people. It began, we tend to say, in 1965 with the creation of the Older Americans Act, which created a health and independence as well as a long-term care infrastructure in this country. It's designed initially as part of President Johnson's three-part strategy to combat the war on poverty, because at that time, older individuals lived in poverty, didn't have access to physician services or hospital services, and didn't have a community-based support structure. When he created this, right along with Medicare and Medicaid, it really created what we have in this country and what we have enjoyed and continue to perfect in this country. It also serves as the nationwide infrastructure that provides the social determinants of health, many of them. And we currently are focused on integrating health and social services because we know the value of having those two structures and systems work together on behalf of people. We talk about person-centered. Well, there's no better way than to really continue to focus on the individual. The Older Americans Act also was distinctive because it is designed to be a bottoms-up process as opposed to a top-down, federally prescribed process. It values the input of older individuals themselves. It encourages their engagement and their participation. Many of the things that are identified in the roadmap are part of the structure we have here. We also focus on combating isolation because we know of the effects of isolation. AARP has highlighted the fact that it's equivalent to smoking 15 cigarettes a day in terms of the negative impact of isolation. And so we are just continuing to use our social infrastructure as a means of highlighting how we can continue to contribute toward healthy longevity, but also we highlight it for other countries to learn from in the UN structure, and we learn from them as well. We also value the contributions of faith and faith-based organizations, as well as local community organizations. In the report, it highlights the importance of spirituality and faith. And in our network of an infrastructure in this country, 62% of our providers are faith-based organizations. And so it continues to recognize that. Irwin, for instance, worked at the, it was then called the National Community Service Organization, which is now AmeriCorps Seniors, and it focuses on volunteerism. And we know of the value of older individuals continuing to give back, continuing to feel a sense of importance and significance, and working toward intergenerational contributions in this country as well. Specifically with regard to healthy aging, we work with an array of partners in the federal government. We have a national strategy under the name of Healthy People, where we focus on metrics and measuring how to improve healthy aging and advance it. And we work in terms of promoting evidence-based interventions that have been proven through randomized controlled trials at the National Institute on Aging and at CDC. And we implement those throughout our community-based organizations. And we've also replicated those in a number of Latin American countries through the good graces of PAHO. We are continuing to work in an array of areas, and we are just so thrilled to be here today to lend support, to continue to advance these issues. And I would want to mention one last thing, which is we're not limiting this to just healthy aging or age-friendly components, as AARP is the leader in that regard. We're also looking at age-friendly health systems as well, because that's how we get to person-centered components. So thank you.
Thank you. Let me ask a follow-up question, because you talked about the strength of the system. Now, can you talk a bit about the weaknesses, and also how do you deal with the equity aspect of older population, poor older population?
Sure. We are, again, fortunate because in the Older Americans Act structure, there is specific reference to and an acknowledgement of the need for equity. Therefore, it is targeted to those in greatest social and economic need, with particular attention to low-income individuals, low-income minority individuals, those residing in rural communities, those at risk of institutionalization, and those who are at risk of being alone, socially isolated individuals.
And weaknesses?
And
weaknesses of the system?
Weaknesses is funding.
Of things that you need to
There's
improve?
never enough. We're not large enough. In contrast, for instance, I mentioned that we were passed as part of a three-part strategy, whereas Medicare and Medicaid, which are entitlements in this country, grow at a rate based on the eligible number of people in the population. The Older Americans Act and the social structure we have is subjected to the appropriations process, the annual appropriations process, and the good graces of the Congress. It is my belief that we have a long way to go in terms of continuing to educate and get key policymakers to understand the significance of investing in aging, in healthy longevity, and in our future, which is long-term care.
Thank you. Thank you very much. So let me now turn to Abby. And Abby, you work on the private sector, and I'm really interested in listening. What could the private sector provide to increase and improve health and well-being of older adults? Please go ahead.
Well, thank you for hosting this, and to the panelists. Edwin, you teed me up perfectly. Thank you very much, because I do represent the capitalist opportunity of healthy longevity, in that I run a private equity firm called Primetime Partners, and we invest in entrepreneurs who build solutions for an aging society, and that's across healthcare, fintech, and consumer. We make investments to very small businesses, pre-revenue, revenues of a few $1 million, hoping that they will be the next unicorns to crack some of the key challenges. And I would say one of the biggest successes of the social infrastructure and government and nonprofit support we have in this country is that it has dissuaded entrepreneurs historically from participating because there was this perception that, well, the government has it. You know, that aging and older adults, that's a government issue, not really a private sector issue. And one of the most amazing things, unfortunately, that came out of COVID is that in the private sector community, every single person became a caregiver. Whether it was for their aunt, their spouse, their grandparent, everyone was helping somebody who was underserved by technology or the health system. For 4 or 5 months, every cover of every newspaper was really exposing nursing homes for all the wonderful things they do, but also all the challenges of financially strapped senior living organizations. And so what we saw at Primetime as an investor is that all of a sudden you had this new generation of entrepreneurs who are now personally impacted by longevity saying, there are some gaps in the infrastructure. There's some resources that are being, that could be brought to this. And most critically, 77% of older adults use telemedicine for the first time. So if you want to talk about a reason why tech entrepreneurs weren't working in the sector, Dean Fried had a slide of myths. One of the biggest myths is that older adults don't use technology. Well, we now know that not to be true because it was necessitated for 2 years of quarantining. And so because all of this, we see an incredibly robust entrepreneurial sector just beginning. I mean, very early days. My colleagues at AARP have been at this game longer than Primetime, and it really is starting to gain a tremendous amount of momentum. But when I read Chapter 4 of the report, one of the areas that I felt at least I could address on behalf of this panel is really one around financial infrastructure and financial security. And so one of the things that I always find amazing is that we have now health longevity, but our financial longevity is going the other direction. And that is only accelerated due to COVID. And so what we see in many of the investments that we've made about 7 investments in fintech companies, is they are starting to chip away at a few of those issues. And I just wanted to briefly chat about one of them. We all would agree longer employment is good for your health, it's good for your bank account, it's good for society. However, that is very hard to come to fruition given a variety of factors that we don't have enough time to enumerate. But what we are seeing is that there are a few early stage businesses looking to combat this. One of them actually works with AARP. It's a business called Get Set Up. It is a live peer-to-peer learning platform that employs about 20,000 retired teachers to teach other older adults to combat social isolation, to enrich, to develop their passions and their pursuits. It is not a full-time living, but every dollar counts. A second area of financial innovation is around retirement savings. I think there are very few things that economists and politicians all agree on, but one is that maximizing your retirement savings as early as possible is an important piece to this puzzle. And the government is, I think, doing a great job trying to figure out how to regulate that in terms of 401k penetration. But we also need to innovate in that structure. We're involved with a business called Penelope that is a self-serve, affordable, flat-rate 401k plan for solopreneurs to small businesses. Everybody should have one. In fact, I will say this, and I say this to every audience, because I've looked at 1,100 small businesses over the past 2 years, and everyone always says, Abby, what's the latest in longevity? What's new? And the first thing I always say is, I'm not going to talk to you about some magic pill or something like that. Max out your 401k. It is the only free money out there. And I am absolutely going to lead a PR campaign for that. You wanted to say something?
And I think what's really exciting about this panel is that we have, all 3 sectors here, right? And I think that's what the commission wrote. That, I think Dr. Wong and Dr. Fried talked about an all-sector approach. And I think one of the things that AARP helped fund was the Aging Disability Independence Forum of the National Academies, and we actually had a workshop that AARP sponsored at the Parsons School of Design fashion school. And that really speaks to what you talk about, the need for additional services and goods and the demand that's out there, where an industry like fashion is not meeting the needs of people, its consumers. And it speaks directly to what you talk about, the need for us to change ageism and the perceptions of aging. And we know that, if people had better perceptions of aging, they live, in one study by Becca Levy, no relation to you, I understand, from Yale, that people live longer by 7 years, and they have over an 18-year follow-up, better functional status, that they're more socially active, that they have more physical activity, and they have less hospitalizations. So I think that, I think realizing that it's both a need for increasing supply, and I think that's where businesses need to be pushed to create those goods and services. And I think it's also changing our perceptions of ageism so that we have an increasing demand, that future consumers see themselves in those ads, in those products, in those services. And I think that's why it's, and I think one of the key parts of this is the business community, and that's why I'm so glad that you're here today.
Thank you. You would like to?
Well, I want to give a chance for us all to discuss, because
correct.
I could definitely
Yeah.
give lots of
Okay.
examples, so we should keep going.
Okay, so, I'm listening to you and thinking about some Latin American countries. And I am basically, I don't know if you run into this issue that as you get older, you get, in addition to being invisible and basically to being subject to a lot of ageism, you become much fragile in terms of your economic situation, your assets, and your income. And we haven't found a way to make sure that, in fact, the financial protection is real, meaning that it's not something that you have to barely survive, but you really have the possibility of enjoying life in your last years in this planet. And I'm wondering if you have any experiences on what to do about it. I know of some experiences in Germany, but I'm not pretty sure if they are, how expanded they are.
I'll jump in on the ageism issue because it is the other ism. And it is it's a critical issue in this country and throughout the world, as you mentioned. And I'm pleased to say that there were 8 national organizations in this country that began an effort to focus on studying ageism and to begin to explore how do we begin to address it? How do we bring about social change with regard to the way that ageism is thought of, similar to the way that society changed in its views about smoking, how at one point it was fine and acceptable, and now it's not. And so AARP was one of the 8 national organizations. This effort is now being led by the Gerontological Society of America. And it follows on the work done by the Frameworks Institute, which really has looked at the way we talk about ageism, the way people think about it, and how they react to it. And then it's focused on developing strategies, metaphors, methods of communicating that will cause society to change the way we think about it. The other component about ageism and age discrimination, and the congressman mentioned this, which is from the standpoint of laws. And here in the U.S., people tend to think that we have lots of protections. As it relates to age discrimination, there are only 2 real protections, one that relates to employment and one that relates to recipients of federal financial assistance. It speaks to the effort globally, especially in a number of countries that are identified in the global report, Global Roadmap report, as well as the effort of civil society globally for the need for a convention on the rights of older persons in order to have adequate protections in law throughout the world.
And I would layer on something that at least I'm seeing, because one of the facts when I started Primetime 2.5 years ago was that while older adults command about 2/3 of the net worth of this country, less than 10% of advertising or marketing dollars is geared towards that audience. And while we could look at systemic issues, I think ageism begins with oneself. And the fact that 50% of Americans don't have a financial plan is because as individuals, we are not valuing ourselves as we age, and we are not thinking ahead to how we want to age. You have to start with your own vision, one person at a time, saying, I'm going to have an amazing experience as I age. My business partner, who just finished the New York Marathon on Sunday at age 88, has said he will live to be 114. And if you have that perspective, that likelihood that you're going to live to be 100, how does that change your view? And so the businesses that we come into contact with are really working with people in their 40s, 50s, and 60s to change, to force them to focus on a definition of how you individually want to age. And so I think there's ageism at a systemic level, but when I think about how to crack that 10% of marketing dollars, that's only going to change when individuals see themselves differently and project their lives differently and plan accordingly, which gets to your issue of financial security. If you don't have a financial plan and you don't embrace asset decumulation as an intentional strategy, which it is, our financial system is geared towards this. Everything is around asset accumulation. The number of businesses and money that goes into asset accumulation dwarfs 100-to-1 asset decumulation. But if we all got comfortable with, well, that's the trajectory. And with health, there's a trajectory there as well.
Yeah.
So I think part of what we're seeing is that we have to individualize and humanize ageism to the atomic level of the individual.
And I think there's evidence to support that when you look at perceptions of aging, that people with higher perceptions of aging engage in more preventive health care. They have more physical activity. And so there is that potential connection that as people imagine themselves as having a more positive future, that they plan for that. And I think that's an important piece of follow-up research in that connection of perceptions of aging and planning for retirement. There's also some evidence, studies out of Yale, that show that when people were subjected to positive images subliminally, that over an 8-week period of time, their lower extremity performance actually improved. And I think that's what you're talking about. Like, we're always absorbing these images of who we should be and how we should act. And I think, you think about advertising, one of the things that AARP has done is developed a series of Getty photos where you have positive images of people of all ages, but also including people who are older, to include intergenerational images. And so that when you're looking for these positive images of people in all walks of life, that they're available to, so that consumers can see themselves in the images that are selling goods and services to them.
Thank you. Before continuing, I wanted to put a kind of a controversial question, but I'll wait a bit. I'd like to turn to the audience and see if there are comments or questions from the audience. Please feel free to let us know. And somebody will pass a mic for you to speak. Yes, please, John.
Thank you, John Wang from Singapore. I guess I would like to ask the panel, especially Ms. Levy, the challenge about so-called feminization of aging, because certainly in my country, in Singapore, a significant number of women are not in the workforce because, especially in my part of the world, they are carrying an inordinate burden of caregiving. And because they leave the workforce earlier, their financial security in their older age is greatly jeopardized. So in Singapore, every person has their own personal retirement savings plan, but that's predicated on working, because when people start working in Singapore, up to 10% of their income automatically gets deducted and goes into a savings account, which they could only draw on when they in their older age. But if you're not in the workforce, that is at risk.
Yeah.
And the same comes with the gig economy. If you're in the gig economy, again, how do you actually ensure that you're putting away money for your future older age? So perhaps, if you can just comment on this issue, especially for parts of the population which are at risk. And you touched on entrepreneurism. I'm very excited about older entrepreneurs. The recent Asia Health and Wellbeing Initiative, organized by Keizo Takemi, one of the co-chairs of this oversight board. This year's grand prize went to an older entrepreneur who happened to be a lady. And she's developed this amazing nail stick-on, which is low cost but highly effective in being able to track people with cognitive impairment. Again, older entrepreneur, she put it all together and developed and won the Grand Challenge Prize for the Asia Health and Wellbeing Initiative. Thank you.
Well, I'd definitely like to meet her, so I'll follow up after this. But one of the things that is wonderful about your question is that the economic disparity is only compounded by longevity, because women tend to live longer. So they have less in savings and a longer time to spend that down. I can just speak briefly to one of the things that we're starting to see, which is real advocacy and action around family caregivers. Because these same women, on average, are 4 to 1 likely to be a family caregiver for a parent or a spouse. And that is a tremendous expense and burden, but there are programs increasingly in the US government to compensate family caregivers. In fact, there's actually $30 billion of unused government benefits that would apply to an aging population. And so we are starting to see there's right now 4 startups that are helping to bridge the gap between family caregivers and government, whether it's VA or other area of government benefits, because people recognize the same way with regular financial services, when you have inefficiencies in the system, the money's there to reimburse in many situations, and my colleague here can speak to that, but the access or the knowledge isn't. That is a great place for the private sector to come in and help bridge that gap. And so we're starting to see people look at that as a fintech solution, if you will. And so that is exciting.
And I'd like to just jump right in there because you are singing our song. And
some planned.
We just launched about a month ago a national caregiving strategy. It's the result of a broad effort, all of society effort actually, focused on government, public sector, private sector, individuals, and it's designed to really get people to think about the issues of caregiving, the challenges of caregiving, and it has recommendations for each sector of society to begin to take action. It is an ongoing iterative process that we are using, whereby as we have issued this initial strategy, we are continuing to collect information and comments for the next strategy. It's been delivered to the Congress, along with a set of recommendations from 2 advisory councils that we convened of practitioners, professionals, researchers who looked at all of the practice in this country and abroad with regard to caregiving to determine the best strategies to move forward. It also speaks to, and you mentioned this, the lack of planning for not only longevity, but all aspects of aging, not adequately planning. And as I think of successful aging and the domains of successful aging, we need to do a better job of communicating what those are across the lifespan, which I believe this report does from a healthy longevity standpoint. to get people to plan over their life course for living a long life. Everyone wants to live a long life, but they want a good quality long life. You can greatly enhance your chances of having a good long life by adequate planning and preparation, exercise, whatever, financial planning, all of the above. And last, I would mention the issue of women. Yes, there are more older women, and what we have done, what we have here is a program that's focused on low-wage earners, workers, mostly women, direct care workers, and we are teaching them how to save. We're teaching them the basics of financial literacy and encouraging them with the knowledge that just saving a little can make a huge difference because of compound interest in the financial sector and all of those things, whereas they don't believe they have enough to do to even live on a daily basis. And it's just been tremendous.
Thank you.
Okay.
I'm sorry.
And I think that this question of work, because Dr. Wang, I think that's a key part of this, is an important piece. And again, we'll take a cross-sector approach because at its best, work allows people to have healthy longevity. And I'm really looking forward to the conversation later today about the business case for healthy longevity. How do we allow people to work as long as they want to or need to? And at the same time, how do we allow that workplace as a social determinant of health to support people? And I think we need to expand what it means to support people as they work to have healthy longevity to include supporting caregiving. So I think that the ability to engage employers in this virtuous cycle where people are given the opportunity to work as long as they need to or want to, and where the work supports them, is a critical part of addressing this issue of feminization of aging and its impact on your risk for poverty.
Yeah, there are a couple of things that I'd like to perhaps ask. One is that, and in our countries, in Latin American countries, we have had experience to basically, we have exactly the same issue. Women living longer and then taking care of other women that are usually their mothers. But the thing is that, and we do have programs that you basically pay for the caregivers. The problem with that is that, in fact, you change one problem for another, because instead of then you have the older adult being taken care of, but the older adult that is taking care of the other, it becomes as slaves. And we have a couple of initiatives of little condominium where people live and basically get services. But at the end of the day, for me, the issue becomes, this is not an individual issue. This is a society issue. And then you can save some money, you can basically do things for your own retirement. But if society doesn't change, nothing is going to happen. It's like the smoking thing. I mean, if you put the responsibility only on the individual, it's very difficult. And then for me, the big issue is how do we transform societies to be, conscious and aware and worried about all their population. So I don't know if you have.
I'll jump in there. I mean, we know that 80 to 85% of all long-term care is not provided by some publicly funded service. It's provided by family members, friends, and neighbors. And we determined that it was a wise investment for us, the public sector, to invest in those caregivers and to support them. And so we provide an array of services. We have a national program focused on providing care to the caregiver so that they can remain healthy, they can continue to provide care for their loved ones, and the entire system doesn't break down as a result. We need more of it, but that's the system.
And I have a bit of a market-driven thought on this, which is while I very much respect the fact that 85 to 90% of Americans would like to age in place, my parents are two of those people, the math doesn't work. The caregiving math doesn't work for every older adult to have another human being looking after them on a dedicated basis. It's just and we know that. We know that given what's going on with the care crisis, with the average wage of paid caregivers, with the 53 million unpaid untrained family caregivers, it doesn't work. And so part of what I look for is where do we need infrastructure that's not being built? And if you look at our senior living infrastructure, there's 2 million senior living beds, and there are basically two ends. Private pay, very expensive, on average $4,000 to $5,000 a month, or senior nursing SNFs or nursing facilities, which are at the other end of the spectrum. And there is an entire middle, which happens, frankly, in affordable housing for every generation, not just seniors, that is missing in our country. And that can be built. That absolutely can be solved for. And so I do think that there are some realities where you just look at the math and you say, this, like, for example, retirement savings. Even if you put as much as you can into retirement savings, we still need other structures. We're going to need to have a reverse 529 where the children are able to put money aside for their parents. If the American dream holds true, which is that the next generation, we educate them, we invest in their education, and they are more successful than we are, then we need a way to efficiently transfer funds upwards. These are things that need to just in the infrastructure. This is one N of one. But, you know, we got to fix housing. We got to figure out upward transfer of funding. Those are two things that would really make a lot of sense.
And I would add that there needs to be a greater sense of urgency. Mm-hmm. The demographics demand it. For the first time in the history of the world, we are at a point where we will have more older people than children.
Yeah.
It completely flips the dependency ratio in every system we know on its head, from pension policy to everything we know, and caregiving. So, yes.
I don't know if there is any, there's a bit of time for a last question from the audience or comment. Yes.
Yes, thank you. I'm curious as to what's missing. That is, the model upon which you're basing care giving is a one-way model. When you speak of the caregiver and a caregiving situation and the burden that it places on the carer, it seems that because this system is not viable for the long term, and I agree with Abby that, you know, there is something missing, and it is not just the financial perspective, it is the way that we care for our elders, and that it is no longer a community responsibility. And there are no good systems right now that I've seen in America anyway. I have seen some in Europe and actually even in Africa in a strange setting without the technology. And it's not always money and technology that are needed to create a good support system. And it's not just caregiving, it's support and mutual support. And to go back to what the first speaker said about the value that an older person can still give, even if that person is dying and even if that person has a cognitive decline, that person still has a contribution to make to society in the simple interactions with someone who needs to learn empathy or whatever that person may be learning in terms of practical nursing care, for example. So what I haven't heard yet this morning is a discussion of how will you change the social structures and give financial motivation to students at universities in tech courses at the University of Maryland, for example, where I consult sometimes, for human-computer interaction courses where students are inventing new things for people with cognitive disabilities. They need financial and government and corporate support to want to go into this kind of thinking about how to restructure America. How are you going to do that? Sorry for the very long explanation.
Yeah. Thank you. Unfortunately, we don't have time to, in this session, to go over that. But we'll have plenty of time in the following sessions. So for now, I really would like to thank our panelists, and please join me with an applause to them.